In the United States, two major health concerns affect millions of people every year: the high cost of healthcare and heart disease. These two problems may seem different, but they are closely connected. Heart disease is one of the most serious health problems in America, and high medical costs can make it harder for people to prevent, detect, and treat it early. Many Americans are worried about healthcare costs. According to QFF, about 64% of adults in the United States say they are worried about being able to afford healthcare costs for themselves and their families. These costs can include health insurance, doctor visits, hospital bills, emergency care, medical tests, and prescription drugs. For many families, getting sick is not only a health problem, it can also become a financial crisis. A simple doctor visit may cost money. A blood test may cost money. A hospital stay can cost thousands of dollars. Even people who have insurance may still have to pay deductibles, co-pays, and out-of-pocket expenses. Because of this, some Americans delay medical care. They may feel chest pain but wait before seeing a doctor. They may skip a checkup because they are afraid of the bill. They may not take medicine regularly because the prescription is too expensive. This is dangerous, especially when it comes to heart disease. Heart disease is one of the biggest health threats in America. The CDC says heart disease is the leading cause of death in the United States. CDC data also lists heart disease as causing more than 683,000 deaths in the latest leading cause of death data. Heart disease can develop quietly over many years. A person may have high blood pressure, high cholesterol, diabetes, obesity, stress, or unhealthy eating habits without feeling seriously sick at first. This is what makes heart disease so dangerous. It often grows silently until one day a person has chest pain, shortness of breath, a heart attack, or a stroke. The problem becomes worse when people avoid care because of cost. If someone cannot afford regular checkups, they may not know their blood pressure is too high. If they cannot afford blood tests, they may not know their cholesterol or blood sugar is dangerous. If they cannot afford medicine, their condition may become worse over time. This creates a painful cycle. Heart disease requires prevention, monitoring, and treatment. But high healthcare costs make prevention and treatment harder. When people wait too long, the illness can become more serious, and the medical bill can become even larger. For example, treating high blood pressure early may be simple compared to treating a heart attack. Later, a yearly checkup may be much cheaper than an emergency room visit. Healthy lifestyle changes may prevent serious disease, but many people do not receive the support, education, or medical care they need early enough. Another reason Americans worry about heart disease is that it affects families deeply. A heart attack does not only affect the patient, it affects their spouse, children, parents, and financial stability. A person may be unable to work. A family may lose income. Medical bills may create debt. Recovery may take weeks, months, or even years. This is why many Americans are searching for ways to protect their heart before it is too late. They want to learn how to eat better, exercise more, reduce stress, sleep better, lose weight, stop smoking, and visit doctors earlier. Prevention is powerful because many heart disease risks can be managed before they become life-threatening. However, prevention must be realistic. Not everyone has the same access to healthy food, safe places to exercise, good insurance, or affordable doctors. Some people work long hours and feel too tired to cook or exercise. Some people live in areas where healthy food is expensive. Some people cannot take time off work for medical appointments. So when we talk about heart disease in America, we must also talk about the healthcare system. Health is not only about personal choices, it is also about access, money, education, and support. The good news is that small actions can still make a difference. People can start by checking their blood pressure, learning their family history, reducing sugary drinks, eating more fruits and vegetables, walking more often, sleeping enough, and asking a doctor about heart disease risk. Even small steps, repeated daily, can protect the heart. At the same time, Americans need a healthcare system that makes prevention easier and more affordable. When people can afford checkups, tests, and medicine, they are more likely to treat problems early. Early care can save lives and reduce the cost of serious disease later. In conclusion, healthcare costs and heart disease are two of the biggest health concerns in America because they are connected. Heart disease is deadly, common, and often silent. High healthcare costs make it harder for people to get help before the disease becomes serious. For many Americans, the fear is not only what if I get sick, but also can I afford to get better? That is why heart health education is so important. People need to understand the warning signs, know their risk factors, and take action early. A healthy heart can protect not only one life, but an entire family's future.